So, did you know that antisocial personality is actually a mental health condition? Well, so antisocial personality disorder is a condition that is characterized by a pervasive pattern of disregard for and the violation of the rights of others. So, people with this condition often engage in impulsive and reckless behavior without any regard for the consequences or the outcome, and they may exhibit a complete lack of empathy towards others. Hi, I'm AC Hatto, a licensed clinical health psychologist, and I make mental health education videos. Please join me as we journey together to create awareness on mental health and also break the stigma surrounding mental health. So, today we're going to be talking about a serious mental health condition called Antisocial Personality Disorder, or ASPD for short. I know most of you hold the belief that calling someone antisocial means that the person is probably an introvert, or that that person shies away from social gatherings or social events. I even remember that in my high school, we used to refer to very quiet people, that people that are very quiet, we used to refer to them as antisocial. Well, far from all of that. So, antisocial personality disorder is actually a mental health condition that falls under the umbrella of personality disorders. It is characterized by a pervasive disregard for the rights and feeling of others, and also sometimes they show lack of empathy or remorse. According to the Diagnostic and Statistical Manual of Mental Disorders, which I always call our mental health Bible, the criteria for this condition includes a history of conduct disorder before the age of 15, as well as three of the following symptoms. 1. Failure to conform to social norms. 2. Deceitfulness. 3. Impulsivity or failure to plan. 4. Irritability and aggressiveness. 5. Reckless disregard for safety. 6. Consistent irresponsibility. And finally, which is the seventh, is the lack of remorse. So you might probably be getting confused with the many terms that I've just mentioned in this video. So let's clarify by explaining what all of these terms mean. So I mentioned earlier that conduct disorder is one of the main determinants of diagnosing antisocial personality disorder. So let me help by briefly explaining what conduct disorder mean by using a case study. I love to use case. So let's meet Seth, a 14-year-old boy who has been displaying disruptive and aggressive behavior for the past few years. He has been caught stealing from stores, bullying his classmates, and lying to his parents and his teachers. Seth's parents have actually received numerous complaints from the school authorities about his behavior, and he has also been suspended from school on several occasions. On top of all of that, he often skips school, has been caught using drugs, and is also involved in physical fights with his classmates or other students. With this scenario, Seth meets the diagnostic criteria for conduct disorder, as he exhibits a complete pattern of behavior that violates the basic rights of others as well as that of societal norms and rules. Again, from the case study, his behavior causes significant impairments in his social, academic, and occupational functioning. Seth's aggressive and violent behavior towards others, his disregard for rules and authority, and lack of empathy are some of the key symptoms of conduct disorder. His behavior has also caused significant distress to his parents and his teachers, who have tried several other means as a source of intervention and treatment to help him. However, he's often resistant to therapy and often blames others for his problem. In all, without proper treatment, Seth's behavior may escalate, and this may further lead to legal problems and social isolation. So I hope this classical example has helped you understand what conduct disorder means, as this is very vital to the understanding of what antisocial personality is all about. Now let's delve into each of the symptoms of antisocial personality disorder that I mentioned earlier in this video. Remember, I mentioned that a person must meet at least three of the symptoms that I mentioned earlier, plus a history of conduct disorder to be able to be diagnosed with antisocial personality disorder. It is also very important to note that a diagnosis of antisocial personality disorder can only be made after age 18 or at 18. Either the disorder is done at 18 or after age 8. So let's explain each of the symptoms of antisocial personality disorder that I mentioned earlier in this video. The first symptom was failure to conform to social norms. This may manifest as a disregard for laws, rules, and even social conventions. A classical example of this will be repeatedly engaging in criminal behavior such as theft, assault, or even fraud without showing any remorse or concern for the outcome. The second symptom discussed was deceitfulness. And this involves repeatedly lying or conning others for personal gain. And a good example of this will be pretending to be someone else just to manipulate others, or even engaging in fraudulent schemes just to make money. The third feature or symptom is impulsivity or failure to plan. And a good example of this could be engaging in risky behavior such as drug use or reckless driving without any concern for personal safety or even the safety of others on board. The next feature mentioned was irritability and aggressiveness, and this may involve frequent episodes of verbal or physical aggression towards others. Examples could be getting into fights, intimidating others, or constantly engaging in domestic violence. The next feature was reckless disregard for safety, and this may involve a disregard for personal safety or the safety of others. And a classical example of this could be, let's say, driving under the influence of alcohol or engaging in high risk sexual behaviors without any form of protection. The next is consistent irresponsibility. This may involve repeated failure to fulfill obligations or commitments. Examples could include repeatedly skipping work, not paying bills, or say failing to take care of one's children or failing to take responsibility of your children. The final symptom mentioned was lack of remorse, and this involves a lack of concern or guilt for one's action. An example of this could be blaming others for one's action or having the feeling that a person deserves some level of cruelty. So, most of you mentioned that you understand the mental health condition better with the case studies that I often give in my videos. In view of that, let's take another case study of how antisocial personality disorder may present itself. We will be using a pseudonym called Samuel. So, Samuel is a 30-year-old man with antisocial personality disorder. He has a history of engaging in criminal behavior such as theft, assault, and fraud. Despite multiple arrests and time spent in jail, Samuel continues to engage in illegal activities without showing any remorse or concern for the consequences. He frequently lies to others, including his family and his friends, to manipulate them for his personal gain. Some will also have a history of impulsive behavior such as drug use and reckless driving, which has resulted in multiple accidents and injuries. He frequently gets into fights and sometimes intimidates others, both physically and verbally. Samuel has also shown a consistent pattern of irresponsibility, such as skipping work and failing to pay his bills. He shows no concern or guilt for his actions and often blames others for his problems. Despite the negative impact of his behavior on his relationships and personal life, Samuel continues to engage in reckless and criminal behavior without showing any concern for the outcome. It is important to note that a diagnosis of antisocial personality disorder should only be made by a qualified mental health professional, as it requires a thorough assessment and evaluation of the individual's symptoms and individual's history. Another thing to note is that a diagnosis of ASPD is not a guarantee of criminal behavior, and not all people with this condition actually engage in criminal acts. Let's also remember that people with antisocial personality disorder are not inherently bad or evil people. They are struggling with a mental health condition that requires compassion and understanding. So let's show compassion and understanding to people suffering with mental health. So, what is the cause of antisocial personality disorder? Like you always ask me. Well, like many other mental health conditions, the actual cause of ASPD is not known yet. However, it is often associated with a history of childhood abuse or neglect or even trauma. Thus, people with ASPD may have experienced significant difficulties while growing up or in their early life that may have contributed to their lack of empathy and disregard for others. Genetics may also play a very important role in the development of ASPD. This means that if someone in your family has suffered from the condition, then you are at a greater risk of developing it too. Diagnosing antisocial personality disorder can be challenging. This is because people with this disorder may not seek treatment or they may be great at even hiding their symptoms. However, a trained mental health professional can evaluate a person's behavior and a person's history to determine if they meet the diagnostic criteria for antisocial personality disorder. Let's now discuss the treatment options. Treatment for antisocial personality disorder typically involves therapy and medication, a combination of both medication and therapy. Cognitive behavior therapy can help people with ASPD learn new coping skills and improve their ability to regulate their emotions. Medications such as mood stabilizers or antidepressants may also be prescribed to manage the symptoms of depression or anxiety that sometimes come with this condition. While there's no cure for ASPD, treatment can help people manage their symptoms and improve their quality of life. At this point, I hope you understand what antisocial personality disorder is all about. If you or someone you know is struggling with this condition, it's very important to seek help from a trained mental health professional. I keep stressing on the trained mental health professional. With proper treatment and support, it is possible to manage the symptoms and live a fulfilling life. That will be all for today. If you found this video helpful, please give it a thumbs up, hit the subscribe button, and share with others. Let's journey together to create awareness of mental health in order to break the stigma that surrounds it. Until next time, I wish you a great day. Bye.